You can safely treat with your DP4 for treatment of the face, body, and also scalp. But I also want to show that at 120 revolutions per second into the skin, you will be able to create an unprecedented vibrational therapy that will dissipate your nerve receptors. You need to get to Toronto as quick as possible. Speed 1 is walking. You can do it, but it's not the most efficient. Speed 2 is like riding a bicycle. Speed 3 is taking a car, but speed 4, private jet. This is the sound of power. This is the sound of speed, the sound of luxury, but also the sound of infusion of 1,920 puncture channels per second into the skin. What makes us feel something on the skin? We have a combination of receptor cells, but also free nerve endings. Epidermis, epidermal junction, dermis. Basal, spinosum, granulosum, we'll skip out lucidum, corneum. In granulosum, you have what is called a Merkel's cell. And a Merkel's cell will register a sensation, an experience, but it won't register sharpness or pain. It will acknowledge the vibration. What registers physical pain are referred to as Pacinian corpuscles, that is an L, Meissner corpuscles, and also free nerve endings. Depending on your own anatomy, and this changes from patient to patient, these which register sharpness or pain will rise up superficial basal, lower basal, epidermal junction, or very superficial papillary dermis. So it means with this that in many cases, for your epidermal procedures, you're actually sitting above the nerve receptors. You don't need use of a topical local anesthetic. Where you are working deeper, again, you may be sitting above the nerve receptors depending on the patient, but also at 120 revolutions per second, we now instigate an intensive vibration to dissipate those nerve receptors. The challenges of using topical local anesthetic. Firstly, your accountant will look at your DP4 procedure and say, if it only takes 3 to 4 minutes to perform the treatment, then your device is only in contact with the skin for less than a quarter of a second. This means that if you're applying topical local anesthetic for 30 minutes, 45, 60 minutes beforehand, it's not very profitable. We understand that speed is instrumental in your success with your DP4 procedure. So our techniques enables a fast, effective procedure. So by the time your patient registers any scratchiness on their forehead, you're already working down on their chin and jawline. When I look at the role of topical local anesthetic, there are two families. The first is called an amide. These include lignocaine, also known as lidocaine. These include prilocaine, and these also include bupivacaine. Amides are great for surface area, but they're not so good for depth. So even if you're working at 2.5 millimeters and you've applied an amide, it's not going to help you. Consideration also that we see a lot of evidence that prilocaine can contribute to post-inflammatory hyperpigmentation and hypersensitivity. The other family of anesthetizing agents is called an ester, and these include tetracaine and also benzocaine. In this case, if your patient calls you up after treatment and says, "You promised my skin wouldn't be flaky, itchy, or sore," but it is, it's not you, it's not your pen, it's your topical local anesthetic. Esters are responsible for producing atopic dermatitis in 18% of the population. The other challenge is that all ester anesthetics are vasoconstrictors. So if you were trying to draw blood, but you can't because of your topical local anesthetic, two things will happen. Number one, nothing. You're not targeting the right visual response. Number two, you will try to overcompensate by treating more aggressively and treating deeper and start creating and risking ablation, dragging and pulling. So when you go back to clinic, you will probably grab your tube of topical local anesthetic and try to determine what I've got, what my risks are, and how to update my techniques. Easy. It's all got to do with spelling. Amides always have two I's in the formula. L-I-G-N-O-C-A-I-N-E, L-I-D-O-C-A-I-N-E, P-R-I-L-O-C-A-I-N-E, B-U-P-I-V-O-C-A-I-N-E. Esters, only one I. So particularly this category and this family is going to be problematic for your procedures and reduce your potential.